We'll give it one more minute. Okay, I think we're going to get started. Welcome, everyone. I'm Rob Murphy. I'm the Executive Director of the Institute for Global Health here at Northwestern, and I'm also Director of the Center for Communicable and Emerging Infectious Diseases, as well as I'm the John Philip Fair, my former mentor, Professor of Infectious Diseases, and I'm a Professor in Medicine and Biomedical Engineering. So we have a very timely presentation today by two very distinguished people. And I think you will appreciate this just reading the title. Too much, too crazy, a pandemic, a presidential election, and global health reporting. I mean, we couldn't have planned this any better than what has happened. This webinar today is sponsored by the Institute for Global Health, but also in partnership with the Institute for Public Health and Medicine, IFAM, the Department of Preventative Medicine, the Buffett Institute for Global Affairs, and Northwestern's Medill School of Journalism. Please take a moment to follow us on Facebook and Twitter at FSM Global Health. In addition, we welcome you to become an Institute for Global Health member to receive access to specialized resources and services that support research infrastructure. And for more information, you can check out our website, very easy address, globalhealth.northwestern.edu/members. Today, we are very thrilled to have with us Brian Simpson and Dayna Kerecman Myers, Editor-in-Chief and Managing Editor, respectively, of the Johns Hopkins Bloomberg School of Public Health, Global Health Now. First, I start with Brian. So Brian's Editor-in-Chief of Global Health Now and editor of the award-winning Hopkins Bloomberg Public Health magazine at Johns Hopkins Bloomberg School of Public Health. He has written stories on everything from the development of the polio vaccine and influence of Islam on public health to the malaria parasite's life cycle. He has published articles from India, Nepal, Cuba, Uganda, Ghana, Nigeria, and other countries. We have huge interest in Nigeria, by the way. Brian earned a Master of Arts from the Writing Seminars at the Johns Hopkins University and a Master of Public Health from Bloomberg School. He also teaches science writing at the Johns Hopkins University. Second speaker, Dayna Kerecman Myers, is Global Health Now's managing editor. Previously, she wrote news summaries as the assignment editor for PBS NewsHour and wrote and edited articles and reports for the Stanford Blood Center. Edited the International Research and Exchange Board's Media Sustainability Index, and wrote newsletters about landmines in Chechnya for the Open Society Institute. She's especially interested in public health in relation to freedom of speech, environmental health, and refugees, and she has worked with refugees around the world, from Utica, New York to Azerbaijan and Tajikistan. She has a BA in Russian history from Wells College. There'll be enough time for questions following the presentations, in which we welcome you to submit questions through the chat feature here. Just put your questions directly in there. And now I turn it over to Brian and Dayna. Take it away. Thank you very much again for coming and presenting this very timely topic.
Okay, take it away, Dayna.
All right. Well, first, we just want to thank you for the really nice introduction and for the opportunity to be here today on this very timely day for this discussion. And we just would like to thank all of the folks at Northwestern for reaching out and planning this and collaborating with us. And I just want to specifically thank Ashti, Kate, Rob, Kristen. We're just really glad to be here. And I also want to thank some of the members of our team. We have Lamari Morales as the Associate Dean for Communications and Marketing at our school at the Johns Hopkins Bloomberg School of Public Health. And she's been tremendously supportive of Global Health Now and given us a lot of great advice and guidance through all of the changes that have been necessary during this crazy year. And I also want to give a huge shout out to GHN's fabulous associate editor, Annalise Winnie. She's the queen of the headlines and a lot of the great summaries and funny diversions, especially that you might read. And she's also done some great exclusive reports for Global Health Now since she's been with us full time since March. So she came on right during the craziest part. And she's done exclusive reports on the presidential debate and the contact tracing in Liberia. So some interesting work from her too. So I just want to give her a shout out. And I just will get started then. For us, we came back from our holiday break on January 2nd, and this was our lead story on Australia's wildfires. But we just had no idea that the second story that day would end up being just would spread like a wildfire that would just engulf and eclipse all other coverage through even this point in the year. So the second story was mystery pneumonia hits China. We were just starting to see more reports in the US around that week when we came back through ProMed, and I know Helen Branswell started talking about it. So we were keeping an eye on it, but it was a second story, and that quickly changed. So I'll just give you a little background on that period, how we started seeing things evolve. We had the January 30th, it was declared a public health emergency of international concern, but the WHO was still saying it can still be contained. By February 3rd, it was looking like a pandemic was likely, and these are some of the GHN headline stories that we've pulled the lead stories focused on these topics. So then by February 12th, we had the name for the virus, COVID-19. And then by March 11th, the pandemic was officially declared. By March 18th, cases had topped 200,000, 1 million by April 3rd. Worldwide deaths passed 250,000 by early May. And then, just some other things going on in the US as the US started to emerge as, one of the hardest hit countries. We also had the twin pandemic of police brutality and racism protests in the US. And so these were all things that very much were on our minds as we made our decisions about what we were going to cover, taking us up to mid-October, where we've seen more than 1 million deaths. So now I'll put it back to you, Brian, to talk about some more of the background and origins.
Okay, thanks so much, Dayna, and a huge thanks to the team at Northwestern, Rob, and everybody. Super happy to be here, super excited, and we understand if you're going to be checking your Twitter feed or your phone during this talk, because we know things are happening out there besides us, crazy as it sounds. So I do want to start off by acknowledging that this is the personal devastation caused by the pandemic. The fact that more than 48 million people have been infected and 1.2 million people have died as a result. And I want to start off by putting it in this big picture view before we kind of jump into some of the media and communications challenges involved. But thinking of it as a pandemic that has upended health systems, economies, and societies, that has cost lives and livelihoods, that has stolen children's precious time for education and even to be a child, and has taken a real mental health toll on all of us. And it's also a virus that, if one is fortunate enough to survive the virus, that it can cause a panoply of symptoms that continue on, and obviously are going to be a focus for research and study for quite a while yet. And it also, of course, has emerged during a time when the US was fixated on a US presidential election and on scoring political points, and when simple time. Join me with this thought experiment. And think about what you were doing and worrying about during your about this time last year. And it was a time when the word coronavirus was unknown to many of us, or if we did know it, it meant a cold. And the US election was still a year away, when all of these priorities, other priorities in global health, had a real chance for our attention and focus. So now I'm going to ask you to wake up from that beautiful dream, as a colleague of mine refers to as the before times, and return to the here and now, as we consider the pandemic and the presidential election coverage. So 4 words came to us for the title of this talk: too much, too crazy. And I don't want to, I think, I kind of think that that's probably what Dayna calls me in terms of the amount of work that I ask her to do, and she wonderfully does respond and deal with it. But I'll tell you too, here's the too much sort of take on it. And then this is 70,000 articles in PubMed just as of November 4th. And that's just the sort of the scientific take on things. Obviously, the journalistic and social media, and it's countless. It really is. Also, so just to give you kind of a barometer of just how crazy this this time has been for all of us, let's start. I want to acknowledge this. First off, the President of the United States becomes COVID positive. That is an insane, huge story on its own. The president dismisses mask wearing, dismisses the advice of top scientists, and says he feels better than ever, having been sick with COVID. So that goes way off the top of the charts for me in terms of a crazy time for our nation and for journalism too. Just a really quick take here on like what we're trying to do. We recognize that you all are experts in your fields and in science and research, and also in the media. And Dayna and Annalise and I are really sort of steeped in the media coverage. And so as I thought about this talk, I realized that it's the public health professionals and the scientists and the journalists are like locked in to each other, and they really can't escape this lock. And then Dayna and Annalise and I are like kind of right in the middle there, in between that. So we're hoping to translate things, and also wanted to know that like we're not trying to do a history of the pandemic here. Obviously, that would take a lot longer than we have, but a real look at the media and science communications and how all of that has kind of fit together. The other one of the big things that I thought about too in this talk is the theme of speed and its role as just kind of absolutely critical in defining the pandemic and the human response. We have, it's kind of been that we've been behind on our assumptions, and we've driven the speed has driven our decisions and made us make unforced errors. It's been kind of a viral shock and awe for all of us. And the key lesson that I've taken away, and I think that this quote from Matt Herper in Stat really defines it, is that the pandemic teaches us one lesson over and over: the virus is moving faster than we are. And for us, it's moving too fast for us to keep up or to get our head around it. It's kept us off balance, moving faster than we can. And in the parlance of military strategy, the virus has beat us by getting inside of our decision cycle. It's that speed has kept us in reaction mode, and we really, haven't kept up. The other kind of big theme that I think we have to talk about today is that mixed messages. And it has been a challenge right from the very beginning, early on in the epidemic. And I'm going to give you a couple of examples. I know this is pretty well known to you, but I do ask that everybody sort of take a look at these as a news consumer would, as somebody who's not in public health, but is a reader, is somebody active in social media, and sees how things play out. So bear with me as I run through these, and I'm going to go through them pretty quickly. That in New York, malaria drug helps patients improve in small study. And we can see how that expands. And I'm going to turn my video off for a moment, just because I'm having some Wi-Fi issues. Okay. So, and we see, and Trump is taking hydroxychloroquine. One of the great highlights, I think, in journalism came from The Guardian in early June by talking about this small company, Surgisphere, that launched, that did the research that was taken on by both The Lancet and New England Journal of Medicine. And it was a terrific piece because they exposed Surgisphere as a tiny company, quote, whose employees appear to include a sci-fi writer and adult content model. And they provided a database and behind The Lancet and New England Journal of Medicine hydroxychloroquine studies. This journalism and this reporting immediately brought two huge retractions. But you can see that the idea of hydroxychloroquine was planted, was believed to be successful, and we're still in a way paying the price for it. And had to include this tweet from a representative in Arizona when President Trump was infected, and he encouraged him to take hydroxychloroquine so he could get better. I kind of think of this as hydroxychloroquine as, you know, those terrible photos that you have in middle school that just keep coming back and you can't get away from them. So that's hydroxychloroquine. Masks, obviously, we had contradictory messages on masks from the Surgeon General, from the CDC, all kind of giving us a sort of a different way to think on things early on. And that was to, you know, stop buying masks, reserve the masks for healthcare workers. And these are messages that, you know, would take a toll later on, including this interview with Dr. Fauci on March 8th, saying right now in the US, people should not be walking around wearing masks. Those comments are really affected things, and they also gave an opening to politicize masks as well. So then by early April, the CDC and the federal government are recommending masks again, but at that announcement, President Trump says he's not going to wear masks. So again, about as mixed of a message as you can get. And I want to move on to some basic science communication fails. And these were issues that have been highlighted. And I think this is a terrific article. Probably many of you remember this Viewpoint article in JAMA on the communication of science. It's by Richard Seitz and Gary Schwitzer. They pull out a few different examples, and one of them is how the presentation of the findings and the challenge therein. So remdesivir, there was a large news release on an RCT, but no accompanying peer-reviewed published article. And in fact, remdesivir, this and another Chinese study prompted remdesivir to be proclaimed as the new standard of care. And so Schwitzer and Seitz, point out that these are things that are being rolled out and happening without a peer-reviewed article being released at the same time. Dexamethasone, another example too, where there has been, initial report on it, but there were challenges, kind of like with that, because the Times did not note that it did note, but it was not, kind of played up as high as the headline, that the source for this information was a news release, and it's not an abstract, a preprint, or even a peer-reviewed article too. So again, this theme of kind of speed taking over and speed impinging on sort of the way things should be, especially during a normal time. And in their critique, Seitz and Schwitzer noted that there was too much of a focus on single study results. There was an overemphasis on results and at times ignoring limitations, and the communications based on so they urge people to kind of resist that need for speed and to provide, take a few moments daily and to help prevent harm. Any professional communicating about this pandemic should spend such time to reflect on the words and the data that data matter, and then act accordingly. I think that's powerful, powerful advice for all of us. I want to go on now to the media focus, and the media, you know, as its job, you know, they leapt on these stories and often, you know, didn't promote the cautions that typically are, you know, kind of encouraged often by scientists. And you know, if you're wondering like why the media does this, I think, you know, speed is definitely one part, but also it's them doing their job. The journalists are doing their job. And I want to do this is I'm going to make this quick. I'm not trying to teach journalism because I know there are a lot of journalists on the call and from the School of Journalism there at Northwestern. But I think it is important to realize what journalists are looking for, and it's impact, it's immediacy, it's proximity, is something near to you. Conflict is always a great subject or cause for reporting. Novelty, human interest, and prominence. These are some of the key characteristics of news. And as you can see, the pandemic sort of basically ticks each one of these boxes because it's global, it's happening now, it's very close to us, it may be have affected people in our family. The controversy is there because of messages are being backtracked. There's a novelty because it's a completely new disease, new treatments. And then also, of course, we have the prominence, right? I mean, you don't get much more prominent than the President of the United States becoming infected with the disease. So in short, media loves big, now, near, fight, novelty, and celebrity. And we had immense amounts of all of this in the pandemic. I want to talk a little bit now, obviously, about the election and that the simultaneity of the election with the pandemic was like pouring gasoline on a fire. I know that's a cliche, but man, is that more true than ever. And every public health step has been seen through the lens of politics and personality. So it's not the typical kind of thinking about like how will an issue play that you know people in public health have to be aware of, but it will. The questions were more like, how will it affect my base in 3 months or 3 days? We all know the result, that our better angels did not survive, right? So the president blaming China for the pandemic, the president on the death toll, it is what it is. You can see too, in terms of scoffing at masks and making masks a problem, and then, you know, and more comments from the president there. But I think that the greatest damage done was successfully implanting the idea that nothing more could have been done. And that was a talking point that was repeated over and over. And it has been to the nation's detriment too. And while I'm talking about the nation, I do want to say, you know, that we really intended to cover, you know, the pandemic globally and we are doing as much as we can. But the US and the US's involvement has constantly pulled us in. And in some ways, it was kind of a reverse paradigm of here's how things should not be done. But it was you know, kind of the media's job to report on this. And there was so much happening in the US that it was very hard for us to turn away in some respects. I thought that Ed Wasserman, who's Dean of UC Berkeley's Graduate School of Journalism, framed this really well and basically as an ultimate test for the media, as a make or break moment. And that this story, he really nailed it in terms of has as many perplexing and meddlesome dimensions to it as none other. And so this was the challenge that the media had to confront. And you know, with varying degrees of success. Starting off, right off the bat, the odds were stacked against the media, and Dayna's going to talk about some of this in a moment. But the trust definitely is an issue. Monmouth poll, they found that the media was trusted slightly less than President Trump. And then also that 73% of Americans see too much bias in news reporting, and they see it as a major problem. At the same time, 36,000 news workers in the US have been laid off, furloughed, or having had to take a pay reduction. So this was the story of a lifetime for many reporters, but also the odds were totally stacked against them in many ways. So I kind of want to like close things out here by saying that that this quote also from this is from Sharon Dunwoody at University of Wisconsin, of the absolute importance of journalism and in the reporting that's going on now, because she finds that if you're in one of these credible channels, a reliable news organization, and you're reflecting flawed science, that people are not even going to notice. So if it shows up in one of our trusted channels, as far as we are concerned, it is true. And if you think about that, that is an awesome responsibility for journalists to have, because not only in a pandemic is especially important because it's shaping human behavior, it's shaping reactions, it's shaping perceptions of the pandemic. And that is probably, for me, like I think one of the biggest takeaways as we think about journalism coverage and the pandemic. I've talked a lot about the theories and ideas behind the science communications and the media and the challenges, but I think it's really important too to talk about some of the absolute standout journalism and writing and reporting that's been going on across all dimensions of the pandemic, from the very detailed science of new treatments and how the virus infects, to global policy issues, to Venezuelans and the challenge that they find. And I highlight this one especially, and I want to read this, just the beginning of this article to you, because I thought it was a powerful example of what writing and reporting can do. And this is by Mike Smith and ran just a week or so ago in AP. This is based in Caracas. Leaning against a hospital wall for balance, Elena Suazo wiggled each foot into blue protective pants. Then she slipped her arms into a surgical gown and snapped on white rubber gloves, finally ready to enter the COVID-19 wing. Suazo is not a nurse. She is a cafeteria worker at a kindergarten in Venezuela's capital. But she is also a loving daughter. Her 76-year-old father, sick with the virus, waited inside. I think, for us, and especially people in all of us in public health, data has become so paramount that oftentimes it's stories like these that do such a powerful job reminding us that these are human stories, that this is human suffering. And feature articles well told like this can make an immense impact. There's so many examples of really standout journalism that I'm going to run through these really quickly. I know you probably all have your favorite writers and authors, but these are both some stories and some reporters who have done incredible work, including Helen Branswell at STAT, Amy Maxman at Nature, Ed Yong, I think, has been doing outstanding work at The Atlantic that many of us have been following and follow him on Twitter and follow everything that he writes. Elizabeth Yuko, writing this piece, a very personal piece in Rolling Stone, is another outstanding piece of journalism. And for me, the person I've really been following is Washington Post reporter Eli Saslow. He's been doing first persons articles that get inside the thoughts of human beings who have been affected by the pandemic. And for me, this is some of the most powerful journalism that I've seen out of the epidemic. And I highlight this one in particular because he followed a restaurant owner and manager in Glen Burnie, Maryland, and talked with him, and then used all of his words to explain his point of view. And it's not a headline many people in public health may appreciate, but it got into the depth of this one man's experience, a family restaurant that had been in the family for 60 years, and he had to close it down. His business, his family were pandemic. They weren't actually sick, but they lost their business, and he tried everything, including set up, outdoor umbrellas and tables so people could eat outside. But the pain that his family experienced was a real reminder too of all the dimensions of people experiencing this. So I think in some ways it helped me break out of my bubble of perceptions of the pandemic. All right, so I'm going to stop sharing my screen now and hand things over to Dayna. I appreciate your time and attention, and Dayna's going to talk a little bit more about the challenges facing journalists. So take it away, Dayna.
All right. Is that working?
Not yet.
Okay, sorry about that.
There we go.
Got it now?
Yep.
Okay, so Brian talked about the challenges that journalists have faced, and we're so impressed by so many of the great journalists and what they've been able to do, realizing how much they're struggling behind the scenes too, not just with their own jobs and job insecurity. Brian mentioned before, that so many newsrooms have had to lay off staff, and this is at this incredibly important time. And also, they've had to battle different challenges just in mobility, trying to get around a shutdown to cover stories. They've had incredible challenges. They've had challenges with sifting through what the information, disinformation is. And that's also impacted how receptive the, public is going to be to media reporting. So this quote here on the impact of misinformation is telling. New research explores how conservative media misinformation may have intensified the severity of the pandemic. And so misinformation and disinformation has been a challenge to sift through. And we've also had this unprecedented role of social media and the rapid spread of misinformation, and different countries and different governments have dealt with that in different ways. We've seen that some facts like misinformation super spreaders on Facebook received almost 4 times more views than their reputable counterparts. And we've also seen social media outlets starting, especially during the election, to label misinformation and flag more content, but there's still a lot of pitfalls. And then there's censorship too. And this is really, we've seen it in a lot of different countries, but not just the usual suspects, but just hiding information, keeping scientists from talking to the press, keeping doctors and nurses from saying what's going on. And we've seen this in a lot of different countries. In China, there's really kind of a turning point in early February when a whistleblower doctor tried to warn doctors around the world that this virus was spreading rapidly with health workers, and he lost his life to the virus. And there were so many attempts to repress doctors and health workers from sharing information, and that ended up not just happening in China. So, in our own country, in the US, we've seen this too. But more on what China did, they also had censors vetting scholarly information. So research papers had to be screened by the censors. So this is even people publishing in international publications. It was just really difficult time. It made it very hard to get to the roots of the origins, the animal origins of the virus, for example. They also rolled out very sweeping use of digital technology, and it's going to be hard to ever get back from that. It was in the name of public health and safety, but it got people very used to that idea. And the Chinese government also cracked down on social media references, deleting posts on the origins of the virus, and also deleting accounts of reporters who were trying to get the word out, just for using words like, different theories about the origins. And another country that we really had a hard time getting information and seeing reports from, particularly English language, that GHN, would be able to share. But the censorship in Iran was brutal, and they really had, doctors were ordered not to list the coronavirus as the cause of death on death certificates. They covered up case counts, and that was exposed just through mass grave satellite images. Journalists were threatened. Journalists were also arrested and threatened in Kashmir for reporting on death counts. And then in Russia, there were, in addition to people, just not journalists, but everyday citizens could face jail time if they hid infections, or if they didn't comply with different directives. So it was a very sharp approach. And also journalists could be arrested and interrogated just for reporting on deaths or on the numbers. So they were constantly being hassled, and there have been that's something that Russia's known for, but it was very pronounced when it's health workers and doctors just trying to share information. And then we see in the US, in a lot of cases, it was more nurses, health workers, doctors trying to share information about the dwindling supplies, about the need for more protection. At the same time that we were hailing health workers for being heroes, they didn't have what they needed to be safe, and they were getting fired. They were risking their jobs. There were, a nurse was fired in Detroit for trying to sound the warnings. And so in this case, it's hospital systems, the way that our health system is structured. It was kind of the bottom line interests of the hospital. And so nurses were really threatened, nurses and doctors and other health workers. And it made it very dangerous for them to even talk to reporters, and it put reporters in a difficult position because they didn't want someone to lose their job in a pandemic. But there were a lot of very brave sources who were still willing to talk and help get these stories out. But that was another aspect to censorship in the US. And then the other side of it was our own government, spewing misinformation, trying to distract, and shutting down normal access channels that reporters would have for getting information. The CDC stopped doing briefings, which, was very, I know the Association of Healthcare Journalists was, talking about this and having threads like, why hasn't the CDC briefed early on, in the spring? Why were, we were dependent on the government's, on, non-public health experts for giving us this information. So there were a lot of different forms of censorship that really made every aspect of reporting during this pandemic a lot more challenging. And, also this made it challenging for GHN to sort through what we would bring to our readers, what we wanted to share, sifting through what we felt were good sources and what were safe and solid, sources, while also giving people an idea of all of the local reports that were so important to trying to get information out, smaller papers that, maybe they were more focused on other issues before. Suddenly they did some great public health reporting. And we were really trying to sift through a lot of information also, and trying to touch on everything that we could. We always, try to give geographic and topical balance to our coverage, but all of a sudden we just had an explosion of information to sift through, while trying to remain, faithful to our priorities with our readers, to present international news, to present things from different perspectives. So we, and I wanted to say also just that, going through those photos of censorship, we can see how, there were some things that helped get to the truth. The lines of ambulances in Russia showed that, outside of a temporary field hospital. Ambulances were lining up as the government was trying to say that the cases were, not a problem. It was lower, the mass graves. And, so there were a lot of other ways that people had to look for information. And it mentions here brave and devoted reporters, but I just really want to emphasize that our sources were, incredibly brave and had a lot at stake, and really wanted people to get the truth. And also there are funders who helped support open journalism. And a lot of the sources that we really depend on are behind paywalls after a certain amount of articles. And we wish that there were more free sources, because that's another ideal of GHN, that we want people to be able to read news, anything that we share. But so many of the well-funded reporting, it's coming from the New York Times, the Washington Post, and it can be frustrating for our readers that paywalls kick in after 10 articles. But some, like the Atlantic, opened up reports about COVID for an open audience. And then there were also some really important donors, like the Pulitzer Center on Crisis Reporting made Science Magazine reports free. But we always want our readers to know, like, our ideal is to find the source that is the best source, and it also is free. And it isn't always possible. It's really challenging, but that's our goal. So when we came back after the break in January and we started seeing the reports, it was a little, it started trickling in. I'd say like by mid-January, we were covering it almost every day in some way, but no inkling that it was going to explode the way that it did. By early February, that had changed and we were leading with it almost every day. So really, here we're trying so hard to cover lots of different issues and not let neglected public health issues fall off the radar, but it quickly became all-consuming. And we also started getting just a lot of reader questions and emails. It was really, hard to sift through everything. And we also, one of the ways that we decide what stories we're going to cover every day, we go through Google Alerts on dozens of public health topics, from NCDs to neglected diseases to, malaria, HIV. So we have all of these Google Alerts set up. And after we set up one for COVID-19, quickly that one ended up being about half of the, half the time, to go through all the other dozens, and then that one, and you get like more than one page. It's like you have to click to see more, and it was just a lot. So the explosion of news made it really challenging for GHN to try to make sure that we were getting our readers the most important takeaways of the day. And through all of this, what Brian touched on with, the speed of the science and the preprint studies. So there are so many pitfalls that we had to keep an eye out for. And so in early February, we launched our expert reality checks. And that was a way to get mini takes from experts who also were being really, asked a ton of questions from different angles and different sources. So their time was really important, but we wanted to have mini takes on different aspects of the outbreak and the response. And then what really emerged as a very big category were personal risk questions. So we were getting a lot of questions from readers about, trying to make sense of what they should do to be safe. And so we launched that, and we're still doing that. And then by mid-February, we had started adding more and more sections. We were tracking the numbers. We were, adding a watch box that was focused only on the pandemic, because there were just so many stories that we thought our readers would be interested in, knowing about, but they're just, we wish that we could have given all of them more attention than we could. So we ended up having kind of a second section of quick hits about COVID-19. And our one-liners used to be on different topics, and we made those only about COVID. So I don't know at what point we'll change back, but for now, there are still, there's still just so much news to try to keep up with on COVID that I feel like we still need those for at least a while. And really by mid-March, it had edged out almost everything else. And so looking back, there were very few days where we led with something other than a COVID story. And then in the summer, all kinds of crazy stuff started really heating up with the US as, you know, the worst hit country in the middle of this election lead up. And so, you know, as Brian had mentioned, we really don't want to be US centric. And we are very alert and sensitive to readers who are, you know, telling us we don't want to hear so much about the US. But we also had readers from overseas write and tell us, no, this is crazy. This is, everybody's worried about this, you know. And you can look on, for example, the Kenya Star today, all of their lead stories were about the US and how, you know, just baffled they are that this is happening here. You know, with all of the craziness. So anyway, we've, you know, tried really hard to adapt and be flexible, and most importantly, be responsive to our reader feedback. So any, you know, readers there today, we really, we do like when you write, you know, my email address is in the footer, you can send me notes. But Brian and Annalise also just letting us know, because we want to be steered by what our readers appreciate and want. So we thought we would give a little turn, and we have a few minutes to maybe do this, but we thought that we'd give you a turn behind the editor's desk to kind of see how we decide what we're going to cover on a given day. So we're setting it up, going back to what we were looking at for story choices on October 2nd. And this was a day I was determined we weren't going to lead with the US. So you go in and you're determined it's going to be apolitical, because we're also sensitive that, you know, a lot of our readers don't, you know, they're worried about, you know, they want GHN to not sound like we're not fair to all political parties. So we're trying very hard. So there's a fascinating story about COVID and women in Afghanistan. This is a very interesting story about why the numbers were less for women, but it's more about them not getting the care or attention from medical services, but it's a paywalled source. So then there's also a story, this was a landmark study in the New England Journal of Medicine that day about the HPV vaccine preventing invasive cervical cancer. So any other day that would have been a, you know, definite lead contender. You know, or the Nobel Prizes were unfolding that week. So, you know, medicine, the Nobel Peace Prize, that could be an interesting look at who might be in the running for that. But then the US president and the first lady both tested positive for COVID, and we were seeing more cases from their circle emerging from the Rose Garden event to nominate the Supreme Court justice. So, and Trump's doctor sends out a statement that just raised more questions than it answers. And clearly, you know, as that unfolded, it was clear that there were outright inaccuracies in it. You know, it was quite a statement. So we had to think through how to handle that. And on the same day, a Cornell University showed that Trump was the single largest driver of COVID misinformation. So if you had those choices, if you want, you can tell us what you would have chosen as the lead in the chat. So just with time, I think, rather than trying to do a Zoom poll, that might be easiest. But if anyone can send a chat, you know, feel free to tell us, because we really do want to be shaped by what our readers care about and are interested in. And we just want to give you a little peek at why, you know, some of it is it's hard to leave crazy things that have been happening in the US that have been unprecedented for scientists and health workers. It's been very hard to put that aside. So, and then, you know, we thought we could lead into questions. I don't know if Brian, you wanted to close on anything else.
No, thank you so much, Dayna. And I did want to make sure everybody knows that Dayna really does the hard work at GHN. She is out there every morning, up every morning at 5 a.m., scouring the global media and evaluating all of this flood tide of stories. So this is what you're seeing here is something that Dayna does every morning. And I don't know how she does it, but she does a
So
wonderful
I'm the
job.
one to send the angry mail to if you don't like.
Exactly. So, yeah, but I think we're ready. We can go to questions now if you like.
Great, great. Thank you so much. What a timely thing. So while we're gathering some questions and comments, I got a issue with the CDC. I mean, I think of all the federal health agencies and everything that they've really been significantly downgraded. Do you guys want to expand on that? I mean, it's kind of started from the beginning of the epidemic when they didn't get the testing right, and then they were not promoting masks. A lot of people said don't use masks, but the reason they were saying that was because there wasn't enough masks for the hospital care people. But anyway, some comments on CDC I appreciate.
Yeah, sure. And I may start, Dayna, and then hand it off to you. But I mean, I think that that's a real challenge. And, you know, you talk about mixed messages, the idea of people saying, don't use masks in order to sort of preserve them for healthcare workers. You know, I think that that's problematic, right? Because, you know, if they're saying just don't use masks, you don't need to, without spelling it out in terms of, you know, like, you know, yes, improvise, you do need to cover your face, but please save the, you know, the N95 masks and the masks for healthcare workers. So being like super clear about that, I think from the beginning would be important. And then two, I think that, you know, that the you know, initial disaster with CDC and testing was, you know, was a real tragedy. And I think that ProPublica and other organizations have really delved into, like, you know, what's happened at the CDC, how has it been downgraded? But that was just a, you know, an absolute tragedy for American public health, I think. And I think it's an institution that has to be kind of like rebuilt. Yeah. So it's not just the sort of the political muzzling of the agency that's happened, but it's a kind of a foundational issue, I would have to say. Yeah.
There was a comment on the Iran situation and how bad it was. It's more of a comment. But I think the bigger picture is, how do you take care of yourself as a health-minded journalist during a time that itself is so traumatizing? Does that make sense?
Dayna, do you want to take that one?
Yeah, I mean, how do you report about Iran, and you know they're lying, and these other places, and the president claiming, you know, he should be getting a Nobel Prize, and, you know, for all the good work he's done. And the thing about the ingest the Lysol, oh no, that was just a joke. How can you deal with that?
Yeah. You know, and in the US, so, I mean, we look at some of the really brutal, terrible examples in countries where journalists are being arrested. I mean, in Iran, there's a 72-year-old veteran journalist, you know, who had to report to prison in August just for trying to report death counts. You know, so while the US is not used to quite so much extreme censorship, it's, you know, we do have a problem. And even, you know, going back, not just with this administration, but when I had worked for the Media Sustainability Index, which covers, you know, freedom of press in all different countries, and you hear from journalists in these different countries, and journalists were being killed in the former Soviet, you know, Soviet Union countries, you know, and they were killed for some health reporting and environmental health reporting too. It wasn't, you know, it wasn't just political. And so we saw the signs that, you know, that was happening. But even we didn't cover the US at that time. We were funded by the US Agency for International Development. But we always said, like, maybe we should be covering the US. And that became so clear in the last few years. Like, yes, we needed that. And, you know, even where, you know, the last, during this pandemic, getting information is so hard from any government agency. They're not allowed to talk to you for an interview. If you want to try to do a quick turnaround piece and you want a CDC source, good luck. Like you're going to have to be prepared to take some time, and, maybe you'll get your interview and maybe you won't. But this has been happening over time too, where, you have to go through the public relations office. You have to, it's like this soft form of keeping reporters out, or, trying to get articles reviewed, which is something that, we try really hard to adhere to these standards of journalism that, that's not, we should be telling people ahead of time, we might check a quote, but we're not going to be, going over the details of a source. But it's been, I just think that we've lost some of that appreciation for what journalists go through with all of the, the ease with which misinformation can be shared online. But I think it's really important to remember how brave journalists are, and it's our, journalists in the US are starting to face many more of these questions and pressures. And some of it is more, the fear of losing their job or not getting the sources or putting their sources in danger. But it's getting worse. So we should be waking up and paying attention to that.
Yeah, a couple other questions here. How might sources of misinformation or disinformation, how could they be better managed? Is there some kind of system that you guys can come up with?
That's a big
You're muted, Brian. Brian, you're muted. You're talking, but you're muted.
Yeah, Dayna may have some suggestions for that, but that is, in a liberal democracy, like, limiting speech is problematic. But at the same time, we're seeing the impact of disinformation, intentional, misleading people. But how to solve that, I don't know. I've noticed definitely in trends in journalism, in American journalism, like people calling out politicians and others for being misleading, and absolutely outright saying that they are lying, which is really pretty rare. So there's that accountability, through the media. But as long as the media is still there, and knowing, the impacts that COVID itself has had on, media jobs, as we talked about. So it's a real challenge, but you've got to confront it. And the other challenge is, of course, that we're all in our own media bubbles, listening to the media that we agree with, that kind of self-reinforces that. So, there are tons of challenges on that for sure.
Yeah, and just one quick thing, we're always trying to give our readers the best source on a given topic, and we try to look at all different kinds of sources from different, different, readerships. But like sometimes there'll be a story and we'll see, because we're reading 5 different sources about it, we'll see that a source that's maybe from a media that we'd really like to highlight, because we just don't often highlight it, but they will have just left out a really key fact that, it just ends up totally skewing the whole story. So it's, it's challenging, like, to sift through. I think that what, Brian said about having multiple sources, looking at, not limiting yourself. And this is true for probably everybody. Just if there's a source that you think is biased against what your beliefs are, like, pay attention to that anyway, and really compare. And we try to do that as much as we can with GHN too. Just, that's
the journalism. And I want you to know that Surge's Sphere office was here in Chicago. We didn't know they existed, but
really? Oh, I didn't know that.
Your office at some high-rise downtown. But anyway, we're out of time. I'm sorry I couldn't get to all the questions, but it was a very engaging presentation. I thank you both for your wonderful presentation. Thanks so much. Thank the audience for joining us and submitting your questions. And remember, in December, on December 4th, we have our annual Global Health Day event, where we're gathering virtually to explore the breadth and depth of our current research ongoing on global health in Chicago. And so please put that on your calendars and look for some other announcements. The abstract submission for that meeting has been extended to midnight Monday, November 9th, so this coming Monday. And so any internal, external students, faculty, community members, partners from any discipline are welcome to participate and present a virtual poster for us. In addition, Northwestern's participating in the Emory Global Healthcare Case Competition again. Please look out for the student application to be released very soon. And again, thank you very much for joining us today from Maryland. For those that have registered, a recording of the webinar is shared and will be emailed. The link will be emailed out shortly if you want to look at this again or need any of the information from that. And that concludes, right on time, today's webinar. Thank you again, Dayna and Brian, for joining us. And
Thank you so
Thank
much.
you.
Thank
Thank you
you.
all.
Bye-bye.
Bye.